Hi, my name is Dr. Jeannie Kim. We are here at Natural Healings in Singapore, and we're here to describe a chiropractic physical exam on a child. This is Christopher. Say hi. First of all, we want to look at the head. Normally, we want the head to be squared in line with the shoulders. Any tilting to the right or left is indicative of an imbalance underneath. So, Christopher, look straight ahead. Look at Pororo. The next thing that you want to check for is the alignment of the shoulders. Obviously, we want it to be straight across and not one shoulder higher than the other. If you look right now, I'm just going to place my hands at his shoulder height, and we'll notice that the right shoulder is at least about a centimeter or so higher than the left. We're just going to look and place our fingers underneath the shoulder blades or the scapula. Again, we'll notice that the right thumb is slightly higher than the left. We're just looking at the tops of the hip bones and guarding us in. Sometimes it can be a little bit harder to check at home, so you should ask your chiropractor to check this for you. In Christopher's case, his right hip is slightly higher, but probably not as noticeable back at home. Starting from the top again, we're trying to see where is the head located in relation to the body. Ideally, it would be right above the body, right? In good posture, so to speak. You want to check to see if that ear hole is standing above the shoulder. In most cases, when kids slouch for a long period of time, the ear hole can start to move forward, so we have that hunched forward look. And in Christopher's case, we have pretty good alignment, just a slight forwardness to his neck, and you can actually see that as well as a little more of a curve in the upper part of the back. The next thing that we look for is the sway back. So you actually want to see a neck positioned over the body itself, and then you want to have a nice slight curvature and a slide forward. In worst cases, kids will have what we would call a sway back, where the belly goes forward, the shoulder comes forward, and this is obviously the most unoptimal positioning of posture. What we're checking for right now is to see pelvic function. When we look at the pelvis, we consider kind of the crux of the body, the center of the body. It's a place where about 70% of all the different muscles in the body attach onto. So a good functioning pelvis is very crucial for the functioning of just about everything else. Right knee up, slow, a little bit slower, and you'll notice that my left thumb starts to drop along with it, and this is considered normal motion. Okay, Christopher, put your foot down. Now, raising the left leg, just like that. Left knee, up. And you'll notice what my thumb just did. It actually went up there. We call this a hypomobile joint. Now, what happens is, if the knee goes down, the pelvis should rock down with it. But unfortunately, when there's a pelvic dysfunction or kind of a stuck joint, so to speak, what it will do is the muscles will hold on to it, and while the pelvis rocks down, the thumb will actually go up. And we need to keep that in mind for future evaluation. Sometimes when children have birth trauma, it causes a difference in the shape of their skull, and that's what we're just simply measuring from. We're taking a point called the external occipital protuberance, which is the center of the back of the skull, and then we're just going to measure from that to the tip of the nose. So let's stay here. So ahead, and you find that. So I'm over here, and we're just going to measure to the nose. Any difference other than completely equal is a significant finding. Okay, now what I want you to see from that perspective is we're going to tuck your chin in, and we're going to roll over, roly-poly, and sit up again. Right, one more time, all the way down. And from that perspective, we'll see a little bit of a higher curvature on this side, right? And it goes forward on this side. So we're going to kind of envision possibly the rib cage has rotated a little bit to the right here. Yes. And we're going to look for the curvature going that way, and then we're going to bend this way and look for the curvature that way. Now one more time, bend to the right. And what we'll notice is that the muscles start to activate a lot more as he's trying to rotate that way, which indicates to us that it's probably more difficult for him to bend to the right. We see all the ribs joining at the sternum. We checked this because, as we saw before, we saw kind of a humping in the ribs on the backside, so we want to confirm that difference in the front. So I'm just going to run my fingers down the middle of the spine here, the sternum. And I'm already feeling a change, and I'm not sure if you can see this on the film, but it's sticking up more on the right side, so I'm going to ask Christopher here for his opinion. So when I press on this side, does it hurt? No? If I press on this side, does it hurt? It hurts? Okay, I'm going to move it down just a little bit. Again, this side, hurt. And on this side, it's painful. Okay. The reason why it's painful, again, we saw that the rib cage had pushed back on the left side and went forward on the right side from the back. And we've just confirmed that finding by showing that the ribs in the front are sticking up a little bit more and have pushed back this way. It's more painful on this side because the ribs are actually connecting into this section through a cartilage, and ribs can also go out of place. It can stick up where it's not supposed to, and it pulls on that cartilage and irritates the nerves in that area. So if we were to correct him, we would try to make sure that that settled back in. Both sides? Which one's worse? On that side, right? Okay. How about here?
A little bit.
A little bit? How about on this side? Yes? Which one's more? More? A lot more or a little bit more? A lot more, okay. So let's check on this side again, okay? Any pain on this side? A little bit? How about on this side? Right? So which one's worse? Is it a little bit worse or a lot worse? I'm gonna try it again. This one, this one, on this side again. So we are now discovering confirmation of symptoms that are basically, it's what we call a kinematic chain, right? All the way up in a chain of body parts on one side. Once the child is on their belly, I just kind of do a scan across the horizon, and it's one last confirmation of any changes in the rib. Again, you can see that the left side is higher and the right side is lower, and we've already determined that that's his pattern, where his torso is rotated in that direction. And the last final thing we'll check while the child is lying on their tummy is a leg length check. We have to make sure the patient is definitely not tensing up in any way, and we'll see if the heels do match up, or in this case it doesn't not. The right side is appearing shorter or the left side is appearing longer, whichever way you look at it. To us, that just means, okay, we need to find out. We know that there's a situation where his left pelvis is hypomobile. It's not moving as much. In that case, we can kind of guess that maybe the right side is working overtime to compensate. For some reason, his underlying structures in the skeleton, not just the spine, but obviously the muscles and the tendons and the ligaments that surround the spine are either shortened, lengthened, tired, weak, and it's our job to correct any and all segments that we find in error. So hopefully his nervous system is able to function better. Okay, well this concludes. Wait, you wanna say goodbye with me? Oh, sit down. Let's go see them. So this concludes our examination of the child. Say bye.